Good evening. Today is Wednesday, August 5th. Welcome to a special live Facebook briefing on the COVID-19 pandemic hosted by the Stanislaus County Office of Emergency Services. I'm Linda Muma with Stan OES.
And I'm Amy Collier-Carroll, Public Information Officer with Stanislaus County. We will both be moderating tonight's briefing, which will be recorded and later posted to the Stan Emergency Facebook page and YouTube channel.
You won't see us on your screen tonight, but you will hear our voices as we direct your questions to our panelists. And because we aren't appearing on camera, we will be wearing face coverings, which may sound a little bit muffled, but we'll do our best to enunciate.
Also, because we got so many questions from all of you in advance of today's broadcast, we will focus primarily on those first this week, but we may have time for a couple of live questions near the end.
Tonight, Stanislaus County Health Officer Dr. Weishan Payan is here. She's joined by Stanislaus County Superintendent of Schools Scott Kuykendall and Stanislaus County Behavioral Health Director Ruben Imperial.
Let's begin tonight's discussion with Dr. V. Dr. V, can you provide the community with an update on COVID-19 in Stanislaus County and point out for us any major changes you've seen since we last talked 2 weeks ago?
Yes, so we are still seeing spread in Stanislaus County, but we are having some statewide data system issues. And so you've noticed probably the last couple days, if you're following our website, that we haven't been reporting as many cases as we had days before that. So I think we're reporting about 51 cases today, but that's going to be an underestimate. So what happened was the statewide reporting system is just really not letting those electronic lab reports come through into CalReady, which is our data reporting system. So they're getting hung up somewhere, and it is really the top priority of the California Department of Public Health to fix this. But for right now, we're developing workaround systems as we are not getting these reports coming into us electronically. So the labs received a letter, all the labs in the state of California, to report by Excel spreadsheet to each individual local health department, and they are working to get that in place. In the meantime, we do have the ability to go into our testing sites, our OptumServe, 2 testing sites in our Verily, and we do have access to their websites where we can download the positive and negative test results and still continue on with our work. So it's going to slow us down. There's been some delays in the reporting, and we're very sorry about that. It's hurting all of us trying to keep our situational awareness going. But we just have to bear with us. If you go to our website, we are just basically freezing the dashboard because it's not going to be accurate until we can get this done. Another way that we're not going to be accurate is our percent positive tests, which a lot of people follow, including me. But during this time when our electronic system isn't working, we are just going to get positive test results and not the negatives. And so we are not going to be able to calculate a percent positive. For the people out there, you'll still get your test results the way you always get them. This is just about public health reporting. So I don't want people to think they're not going to get their test results. So today for deaths, we are reporting 10 deaths, sadly. So we do know that our deaths have stayed about 1.5% of our cases, and they're continuing on in that way, which we're very sad about.
Dr. V, let's stick with you for just a moment. Hospital staff has been spread thin, and we know that some have needs that were tough to fill early on in the pandemic. Are healthcare personnel getting the PPE that they need now, and how is the county assisting?
So I think I'll start with the last part of that question. So when hospitals and healthcare need their personal protective equipment, their PPE, they put in a resource request to the county. And we work with the state to get those all filled. And so that is the process, and it is working. There is still PPE constraints, as they say. So if you go to the CDC website, you can see that there is guidance up there for a constrained supply, and the whole United States is following that guidance. So you do hear about using the same PPE, and that is true. I mean, that is the guidance that is on the CDC website. So just remember that PPE is disposable, but it is not necessarily single use. And so The healthcare providers are reusing PPE in a way that is approved by many different places, including the Centers for Disease Control.
Thank you, Dr. V. Let's go to Ruben Imperial. Ruben is our Director of Behavioral Health and Recovery Services. Ruben, the last time you were with us, you spoke about increased calls to mental health crisis lines at BHRS as a result of economic uncertainty, isolation, etc. Has that trend continued?
Yeah, we did see spikes in the multiple access lines, crisis lines that we have, and that has over the last 3 or 4 months has been sustained in terms of whether it's our suicide prevention hotline or our access line to programs and services. We are seeing those increases. We've also been really promoting those lines as well. The 558-4600 number is a number that community members can call. They have a concern about their own mental health or the mental health of someone that they care about. So we've been really focused on putting that number out through the EOC and through other partnerships that we have within our community. So on a positive note, people are calling, and they're calling about for folks in this that are receiving services, concerned about the continuation of their services and staying connected. They're calling about accessing resources, accessing treatment support. They're concerned as well. So we're continuing to monitor that and continuing to really look at why people are calling. And we just want to encourage folks that, there is absolutely, our access lines are there for you to call. And, a lot of times when folks are dealing with mental health concerns in their life, they have a lot of questions. It's not clear on what they should do, whether it's for themselves or a loved one. You can call us and you can actually share the experience if it's for yourself or for a loved one, and we'll advise you. We'll say, this is something you should take care of right away. We can refer you somewhere. We also have been able to stand up what's called a COVID-19 crisis team. So basically, when you call our access line, we have a crisis counseling team of mental health therapists, mental health clinicians that are available. And you got something you want to talk about right away, they can refer you to that crisis counseling team. So that's been in operation, I believe, now for a few months, and it was done in response to the community. So we have seen some calls go to that, and we're also preparing for where we imagine in the next few months we'll also continue to see some of those challenges and some of those concerns in the community as well.
Ruben, do you mind just repeating that phone number one more time so we can get that?
Yes, the number is 558-4600.
Okay, thank you so much. Let's go over to Superintendent Scott Kuykendall. Scott, your team has been working very hard to make sure that students have the tools they need to be successful academically while making sure that our teachers and our families are safe as well. Can you give us an update on schools in Stanislaus County?
Absolutely. So I want to begin with the status of Stanislaus County. And as you all know, Stanislaus County is one of 38 counties in the state of California that is currently on the watch list. What that specifically means for schools is that because we are on this watch list, schools cannot open to in-person learning. Now, our districts for really the months of April, May, June, we're all working hard to ensure that they could open for students in a safe way. We had been working with Dr. V and our public health department working on reopening guidelines that were published back in June. So with the watch list that was really imposed, I would say probably 3 weeks ago, our school districts have really had to pivot. And I know that there are a lot of students and parents out there that are really disappointed in the fact that we have had to shift to distance learning. What I want to talk about a little bit is how is distance learning going to be different than what we experienced last spring? And it was made very clear in Senate Bill 98 that there are definitely accountability measures in place that need to be practiced by all of our school districts. So what are some of these different accountability measures? They have to do with student attendance and monitoring, checking in on students, student contact, grading, and instructional minutes. So those are just some of the things that schools are obligated now to monitor and collect data to ensure that the distance learning programs that are being provided are much more rigorous and robust than we experienced last spring. That being said, we have some other issues that are taking place that affect schools as well. I know that there are a lot of folks out there wanting to know, well, what is going on with high school sports, for instance? And the CIF, which is the governing body for high school sports in the state, has said that there will be no high school sports at least until December, and then they'll revisit that. So no sports programs, unfortunately, are happening at the high school levels. There is the opportunity still for outdoor conditioning for students, so that is still something that that is taking place. Throughout the summer, the County Office of Education has been receiving PPE for all of our school districts. So the state is providing PPE with student and staff masks, staff face shields, hand sanitizers, and a variety of other needed essentials. So as we've been receiving those shipments, we've been getting them out to the districts so that when school does resume, districts will have the needed PPE in place in order to open. And that's where we are on schools right now.
Follow-up question for you, Superintendent Kuykendall. This one came from Facebook in the last few days. Is it true that districts in Stanislaus County are considering canceling the entire 2021 school year? Do you think that schools will open back up anytime this year?
So for the first part, is it so canceling the whole school year? No, nobody's considering canceling the whole school year. We are shifting to distance learning, and what our hope is that the folks here in Stanislaus County do what they need to do. We really need to get these numbers back down. We need to get off the watch list, and as soon as that happens, schools can begin submitting waivers in order to reopen schools. I don't have a timeline on that, but I do believe that schools will reopen this year. My push would be that we really begin with our elementary school programs. Specifically, kindergarten, first grade, second grade. It's those students in that age group that direct instruction, the face-to-face learning with their teachers is so critical. Now that may look like bringing them back in small groups to begin with or alternating days, but I believe that it will be possible to open up elementary schools. It will be easier to do that than junior highs and high schools. Because elementary schools students are contained in a classroom, you've got less mixing. Junior highs and high schools is going to be more problematic because you have students changing classes, they're mixing with more of their peers and staff, and that can be problematic. But I am optimistic that we can reopen schools this year. The sooner the better. We just really need to work hard on getting our numbers down.
Thank you, Scott. Let's go back over to Dr. V. Speaking of numbers, our numbers in Stanislaus County are high, among the highest in the state. We have been told by the governor that we are on a watch list, and last week we learned that a strike team, including state agencies, would be deployed to help us decrease the spread here in the Central Valley. Who is on this strike team, and what will the strike team be doing specifically?
Yeah, thank you for that question. So we have spent the last 2 days with the strike team, all day yesterday and all day today. So the strike team is members of the California Department of Public Health, and this is who came. California Department of Social Services. We had California Department of Food and Agriculture, CalOSHA. I think that was it. And we have been, and so there were many representatives from California Department of Public Health. And we were discussing many things, drivers of spread in this county, which we talked about, gatherings, home gatherings, quite a few of those, and then our agriculture sector, all through the food sector, from growing it all the way through to, getting it in your grocery store, primarily among employees. And how can we best protect them, and what do we need to put in place to be able to slow down spread in our community? So it was 2 days of talking about many things. One of the key issues, of course, is testing and testing turnaround time. It is very difficult to impact spread when it takes so long to get test results. So everyone who has symptoms and gets tested is supposed to be following isolation orders, regardless, until the test results come back. And then if they're negative, you can go off those isolation orders. And those are posted on our website. And then if you're positive, of course, you have to complete that 10 days total of isolation from that time of symptom onset. And that's all detailed out on our website. So whether it takes a while to get your test or not, we really would like everyone to follow these orders and really try to slow spread in our county. So there are some things we talked about. There is a couple tests that have come out now that are antigen tests. So that's a newer test. The test we're doing right now as a diagnostic test is PCR, but there is also an antigen test. It's kind of like if you've ever gone to your doctor's office for a flu test, they do it right there in the office. It's the same thing. That's a flu antigen test. So there aren't very many. They're kind of new and they're hard to get. And so we would like to get those and take those out to the field. So we've started mobile testing using EMS, contract with our EMS agency, and going out into our agricultural sector, the fields, wherever they are, and doing the testing. We would really like to have a test that you can get results right then, instead of having one where it comes days later and then you have to go find people, because people aren't always in the same field when you go back looking for them. So it would be helpful. It's not a perfect test. A positive is a good positive. A negative isn't necessarily the best. So it isn't as good as the PCR test we're doing routinely, but it would give us results right then, and it can help us make decisions. So those are some of the things we've spent the last 2 days talking about with this task force.
Thank you, Dr. V. Speaking of testing, diagnostic testing, how is testing capacity currently in our county?
So we were quite full for a couple weeks, but it has opened up. So there are appointments available. I believe if you need a test, you can go on our website and sign up for either of those for tomorrow, and there is still availability. We had scaled up some of our testing, and so there is still wide availability right now for that sample collection. So we get asked about our turnaround time quite a bit. It's longer than we want. It's right now running about 5 days perhaps, hopefully at the most. I've seen some that have taken 7. We thought we were having a really long turnaround time, but it looks like some of that was in these reporting delays that they've just gotten worse and worse through our electronic system. So. But right now, I think according to our website, it was about 4.5 days, and according to reports from these sample collection sites that we have, it's running right around 4.5 days. So it's in there. We'd like it more like 2 to 3, but it's not as long as it was. It is improving.
Dr. V, we have one more follow-up question for you regarding testing. Did you want to address the rumors that are circulating on Facebook and social media right now, rumors such as people here in our community not showing up for a test, but we're told that have received notice that they tested positive. Is this happening in Stanislaus County?
So I have gotten a few of those rumors. Well, I'm calling them rumors. I don't, I haven't proven them to be true yet. Myself, and every time I've tried to track it down, it just ends in, oh no, it wasn't me, I just heard about this from someone in a different county. So I would ask that you contact us if this has happened to you. We really want to know. We've assigned a person to run this down. There's a couple things about that. First of all, I've heard that, our testing numbers are too high. We don't count anything without a confirmed laboratory test result from a laboratory in our hand. So that wouldn't be counted. It's not what's making our numbers go up. Second of all, if someone's calling you or sending you an email, saying you had a positive test when you've never been tested, that's clearly a problem, and we need to know about it, and we will track it down and hopefully try to take care of that, because that's not right. The reports we got were all different labs, all different testing sites, like, Kaiser and Sutter, and there's just nothing that is the same about those. They don't use a same system, they don't use the same lab. The lab shouldn't have any information if you never got tested anyway, you never got your swab taken. So it doesn't seem to be true, but if it is, we certainly want to know.
Thank you, Dr. V. Let's go to Superintendent Kuykendall. This one is a Facebook question. What are schools and districts planning to do to support the mental health of our children in the new school year?
So that's a great question, because it is one of the things that is most pressing, I think, on our students and families right now. Now, speaking on behalf of the County Office of Education, we are pushing out a student wellness program to our students. I was just part of our teacher staff development today that dealt specifically with, via distance learning, how are we developing relationships, building those, sharing with kids, checking in on them, all of the things that we're trying to do remotely that typically we would be able to do in a face-to-face setting. I know that our districts are making attempts to do similar things. It is really problematic. It's one of those things that I really worry about, and that's why I mentioned before just the possibility of opening elementary schools as a start. As soon as it is safe, I really want to have students come back, because students see schools as their safe haven for many things. And it's not just, meals and the school nurses, but you have people at the sites who are going to be advocating for them. We know in Stanislaus County that there are certain crimes that have gone up, crimes against family, domestic abuse. We know that there are things that are happening in the home, and right now educators, we don't have the ability to address those things that desperately need to be addressed. So there's that piece, and I'm also very excited about the fact that our districts are now partnering with BHRS. Our districts have submitted their representatives, and actually Ruben Imperial is heading that up, because we realize that in Stanislaus County this is a pressing issue. The pandemic is one crisis. Our student wellness is an entirely different crisis that needs to be dealt with.
Thank you, Scott. Let's go to Ruben then to follow up on that question. How are our social services and programs, specifically BHRS, ensuring that kids are okay this year?
So thank you. As Scott said, schools for our kids in our community is one of those areas where they find help, they find support, and our teachers, our counselors, are there every day interacting with kids, and that's in large part where we do get a lot of referrals. And so as the pandemic hit, we started to see a decline in our Child Protective Services cases. We also started to see just within the last month or so, decreases in referrals to mental health as well. So we're catching up, or at least we're seeing that trend now. So one of the things that we have done is to prepare ourselves and to make sure that we can respond as the needs arise. Myself, the director of our Community Services Agency, Kathy Harwell, Supervisor Withrow met with Scott and the other superintendents, and we are planning to start to meet as the school year starts, and in the beginning to monitor, to make sure that as kids return even virtually to school, what are the needs, what are they seeing, what are the concerns, and then of course as kids get back on campus, even much more attentive to those things. So what we're doing is we're building the partnerships, or actually we're leveraging the partnerships that we already have, and we're building on that. I'm meeting weekly with our Children's System of Care leadership. We also meet with the senior leadership of all of our contract agencies that provide mental health services in the community, and we're monitoring this closely. We're developing plans to, in traditional ways, we reach out to our partners in our organization, our school partners, but we're also beginning to think about how we're going to reach kids and moms and children and fathers with this information that they need about how they can get help. And of course, these are all things that are new. I've said before, the modern mental health system as well as the modern education system has not been through a pandemic. We've not had this change in terms of this much social isolation and all the things that come along with it. So we're concerned about the future, but we're also getting prepared and we're working together. So that's what we would like for the community to know, is that we are working together, and this is something that we're working on weekly, daily, actually. So.
Thank you, Ruben. Let's head back over to Scott. This question came into Facebook. We know that some people applaud the fact that schools won't be opening for in-person classes, and then there's others that want kids to go back as soon as possible. What are the major considerations that you're having in meetings? And in terms of distance learning, will teachers be in the classroom or will they be teaching from home?
Okay, so let me answer the last part of that question first. Will teachers be teaching from their classrooms or will they be teaching from home? And the answer is yes, both. It's going to depend on your district and your situation. So depending on your district, some have made allowances if you have school-age children that you can opt to teach from home. And then we have the issue of, are some of our staff older or do they have underlying health conditions? Obviously, provisions are then made for those particular staff members to teach from home as well. And then we're going to have a large number of staff who are actually coming back and instructing from the classroom. And teachers are very much split on this, what they want to do. So it's really a both and answer, just depending on your district and the situation. So folks are trying to be as flexible as possible. So the major considerations that we really discuss when the superintendents from the 25 school districts here in Stanislaus County get together, quite frankly, first and foremost, is always student and staff safety first. And really looking at how best do we move forward given the current status. And the status is changing so quickly that we are meeting on a weekly basis, typically. There are even some weeks where we, as a collective group, we meet more than once when we're trying to address different issues that are coming up. So not only that, we're talking about distance learning, we're talking about how to provide supports for students and parents. We totally understand that this is a difficult time. This is a difficult time for my wife and I. We have 2 school-age children, and we're trying to figure out how do you have that balance between working full-time and your students' distance learning, and how do you monitor that? So we understand that that is an issue. We're looking at connectivity. Do our students have connectivity? Do they have the supports that they need to fully engage in distance learning? And a lot of our districts right now are, one, ensuring that obviously all students have devices, if that's how they're conducting distance learning. They're also issuing portable Wi-Fi, the MiFi Wi-Fi, you guys know what that is. They're doing a variety of things to ensure that if students need connectivity, that those students have those supports available. Again, we're talking about how do we enhance outreach, not only to our students, but also our parents, because we understand that parents need to be monitoring the learning that's happening, and we understand it's very problematic as far as, how do you do that? How do you fit everything into a day, and how do you make that happen for kids? So those are really some of the major considerations that we're talking about. We obviously established the reopening guidelines back in June. So as soon as we are able to apply for and get waivers approved, we're talking about what does that look like, what modifications have we made to our campuses, how many desks do we have in a particular room, how can we bring students and staff back safely. So that's really what we're talking about when we're getting together.
Thank you, Scott. Just a quick announcement for those of you who are just joining us or who logged in after we got started. Once this recording ends and posts to our Facebook page, we encourage you to go back and watch the video from the beginning, as your question may have already been answered. Let's go to Dr. V now. This is a question that's come in a couple of times from Facebook. You still haven't passed a county mask order, the question says. Why not?
Well, because the state has mandated the wearing of a face covering in all public places. And you can go to the state's website and see the details. But with a state order in place, there isn't a reason to have a local order. And quite frankly, it causes a lot of confusion when there's a local order and a state order. So since the state has put the order out, we are referring to the state order.
Okay, Dr. V, we'll stick with you for just a moment. Many businesses have closed temporarily because of outbreaks, and we understand that workplace to be one of the most common exposures. There is a Facebook question that came in asking if there are plans in place to address workplace spread, or is that being left to the businesses?
Yeah, so there are guidance documents that are out on the State of California website. That website is covid19.ca.gov if people have not visited that. So every sector has very detailed guidance on how to stop spread and what the best and safest practices are for each individual business. And so those guidelines are there. What we find as we respond to outbreaks is that people think of their coworkers as kind of like their second household. And so they tend to be more relaxed around them. So they're very good about following the guidelines around the public, but less so around their coworkers because they're comfortable and familiar. And you spend a lot of time with them. The problem is that leads to practices like, taking off your face covering and being with them closer than you ordinarily would. We pay a lot of attention to break rooms because break rooms tend to be a place where people take off their face covering and eat and drink and might sit closer than 6 feet. And so there are things we look at when we're responding to outbreaks at businesses. So we expect the businesses to follow the guidance that is in place. And then we try to help them with some gaps that might be seen and what we frequently find. So like I said, the break rooms is one. So people need to remember that that's not their household members, and you need to be just as careful around your coworkers as you are around the general public that are frequenting your business.
Question for you, Dr. V, on COVID-19, the illness and treatment that is available. Some have asked specifically about hydroxychloroquine. Do you have good information on that and ways people are being treated?
So there has been a lot of study of the hydroxychloroquine, and they've done it with or without azithromycin because that's been some of the medications that came out as perhaps having good activity. So when they started doing studies, they would look at the activity that this medication would have in a test tube, say. And it looked like it would inhibit growth, but in a test tube isn't the same as in a person. So when they did these studies, they didn't work. There really was no difference in people who were sick with and took the medication and didn't take the medication. So the hydroxychloroquine didn't really have an effective response in people. There is a medication called remdesivir that does at least shorten hospital stay. From, I think it's 14 days to 11 days. It's about a 3-day shortening. And so that has been approved for treatment, and it is being distributed out to the hospitals. We get allocated a supply each week, and we distribute it out to our hospitals in the county. So that is available. There is not enough for everyone. It is used for people who are more seriously ill, right? There isn't an outpatient treatment or treatment for anyone with just mild illness, mild being not requiring hospitalization. There is one more medication that has been shown to be effective. So people who are in the hospital, I hope you remember that usually is in the second week of illness, not that first week. And often what it looks like is the immune system is just overactive. It's just really responding to a lot of things. And so one of the medications, dexamethasone, that is a steroid, it's an anti-inflammatory, and that is being used because it just kind of calms the immune system down so that isn't harming the body and the body can recover. So there's a couple medications. It's all for people in the hospital with severe disease.
Thank you, Dr. V. I want to head over to Ruben. Ruben, there's been a lot of people that are feeling extremely lonely and may just need to talk to someone about their situation and the fears that they may be having. Does the county offer counseling or anything like that?
So what the county does offer is, as I mentioned earlier, the 558-4600 number. And what that is that's what's called our crisis line, our crisis support line. We have established what's called we call it a COVID-19 crisis counseling team. And of course, this is support over the phone. They are mental health clinicians, and if someone calls and they feel they want to talk to someone right away, they can ask for the crisis counseling team, and they'll be transferred over. What we say is there are various options for folks. If you have health insurance, you can call your health insurance company, the number on your health card, and say you are seeking mental health services. And most of the health plans do have referrals to mental health treatment services. And what we'll also say is you can also call us as well, and we can actually help facilitate the process as well, especially if you're in immediate crisis and you really do need to talk to someone. As we said, we do have crisis counselors available. So, and what I also want to mention is that, we also want the community to be thinking about prevention, and these crisis lines are available. But we also want folks just to really be intentional about, for their own mental health and the mental health of their loved ones, really start to think preventatively. And when we say prevention, it's trying to increase your social connection. We know with physical distancing it's hard, but we really got to be intentional about making sure we're connecting with friends, our family, our faith. Find ways to get involved. And again, it's very challenging with the physical distancing, but getting involved in helping your community, getting help involving others, these are all things that we can do in terms of helping us get through this situation. And of course, as and that's for many of us, those are things that can keep us healthy before COVID or during COVID. But we do realize that folks will, because of the situation, because of the crisis, they're more prone to developing a mental illness or a mental health crisis. And we want folks to know, don't sit there and try to figure it out on your own. If you have a concern about yourself or a loved one, call the number. That's what we're there for. Even if you call us and say, I'm not sure about this, I just have a question about it. If you're a counselor at a high school and you have a concern about a student, pick up the phone and call the number and say, I'm here with someone, we want to talk. If you're there in the living room or you're on the phone with a loved one, you can call with the loved one and say, hey, let's call the line together and let's get help together. So just want the community to know that they shouldn't feel any hesitancy with any concern about a mental health issue to call your local behavioral health department. And again, that number is the 558-4600 number.
So just to dig into that a little bit, Ruben, while we have you, a lot of people are concerned about the mental health of those that are close to them right now specifically. So when should we reach out to you, or what should we be looking for as far as signs in others and in ourselves to know that we are ready for that additional help?
Well, in general, when it comes to a mental health illness or a mental illness, we all have. It's perfectly reasonable that many of us through this pandemic will experience some depressed mood or some anxiety, and for many of us, we could get through that fine with our existing supports that we have, and the way we get through those crises before COVID, for many of us, those supports are going to be enough for us. And one of the things that is a concern is when those mental health concerns, the mood or the anxiety starts to impact your daily living, starts to impact your ability to connect with your friends, your family, your loved ones, when it starts to affect your ability to work and to stay housed and stay employed. So when you start to see those signs pointing towards where it starts to impact your daily living, then those are the precursors. Those are things that you need to be aware of, and whether it's for yourself or a loved one, to say, look, I need help. I need to reach out to folks and get the support that we need. And the good news is mental health treatment works. Just as with physical health, there are things that we can do with our mental health that help make those improvements, and we can get well right away. So reach out, and and as I said earlier, don't wait for those things to become an impact in your daily life. Let's start focusing on prevention. Let's start connecting, and those things can help us be much more preventative. But in the event that you do need that help, please give us a call, and we're there to help you answer those questions and get to the next step.
Thank you, Ruben. Let's go over to Scott. Scott, there are some people that are concerned about distance learning creating a greater divide between households with resources and those without. For example, some parents are hiring tutors while that isn't possible for other parents. How are you focused on equity through distance learning?
Another really good question. And I think that this question regarding equity also can tie into how we're trying to meet the needs of our special needs students and those students with IEPs. I think it's a lot the same answer. So I talked earlier about the different accountability pieces that are required via this distance learning protocol. And one of them absolutely is, teacher office hours. It's one of those things that, teachers are needing to make themselves available. But our schools are using a variety of different platforms. It could be Google Classroom, it could be Zoom, and our teachers are more prepared this time around using some of the more advanced functions to actually deliver instruction in a more creative way, allowing students to work in small groups, even though it's all done virtually. So some other requirements that are going to be happening, we've got daily live and pre-recorded lessons and demonstrations. Teachers now have a requirement for actual minutes of teaching per day. So we know that those lessons, they could be live, they could be videotaped, but those will be coming out for students. Daily posted assignments, and what that means is those daily posted assignments, we will be doing a better job working with parents. Parents will be better able to see what is happening, be able to follow up with teachers, be better able to assist with our students. And then for those, in those situations where a device or connectivity is an issue, obviously we've got packets and physical materials that will actually be provided and delivered to homes, or arrangements will be made for folks to pick those up. So there's a lot of different things that are happening with the idea of equity, with the idea of how do we meet the needs of our individual students wherever they may be and whatever their needs currently are. Again, I understand this is not a perfect situation, but we are going to make a very valiant attempt at doing what is right by all of our students.
Thank you, Scott. A lot of parents are concerned about what to do with their kids as far as child care. And we saw a story in the Modesto Bee suggesting that daycare programs, along with Head Start programs and others that have allowed children an environment to be together while parents work, will now be shut down for a time. Is that accurate?
Yes and no. It really depends on the particular program. What we saw with some of our Head Start programs is that earlier, and when I say earlier, I'm talking May and June, they were able to be open, and there didn't seem to be any issues with outbreaks or spread. What we've seen, though, as our numbers in Stanislaus County and here locally in our valley have gone up, we've had more cases. Now, the cases are typically the adults working in the program. And just like everywhere else, what we see is, after Mother's Day and then after 4th of July and, some of these bigger celebrations, we see a greater number of positive cases, which means then that staff needs to quarantine. In recent days, we've actually had some of our Head Start programs that have had to quarantine for a period of time. But this is part of a more complicated issue of child care in general as it is needed. And we understand that there are those essential workers that absolutely need child care. We understand that there are folks that are working full-time that need child care. And it's really a matter of can we safely provide child care on a consistent basis so that's sustainable. We at the county office are very much in favor of, and we will be offering childcare for our staff as they come back online. But it's going to look very different. We're going to have small groups of students. We're going to have a lot of different safety protocols in place, and our parents will be on the same site as their children. So that is different than a school setting where you have a much larger number of students in more confined spaces. So it's an issue that we constantly wrestle with. I know that people are asking questions too about, well, what's the difference between sending my kids to school and sending them to a day camp? And I think that that's a valid question. I think that the answer is, well, we really need to look at the number of students, and then you need to look at how is it conducted. I mean, is it outside? What social distancing is in place? But just know, kind of going back to what I started with earlier, because we're on a watch list, we cannot have in-person instruction in our schools at this time.
Thank you, Scott. Speaking of the watch list, let's go to Dr. V. We understand that we are or were in the top 2 counties on the state watch list. I think that may have changed just within the last couple of days. What does this mean, and what is the technical support that the state is said to be providing that will help us get our numbers back under control?
So the watch list, or the county monitoring list, is the list of the counties who have surpassed set criteria, which really involve spread, number of cases, percent positivity. They also look at hospital capacity and intensive care unit capacity. So, as I think everybody has recognized, we have been seeing a lot of cases in Stanislaus County over the past month to 2 months at this point now. They really started going up around the beginning of June, middle of June. So last week we were averaging about 230 cases a day. That's a lot. So we need to get that below about 50 cases a day, somewhere below 50 cases a day to get off this watch list. So it's really just a marker of spread. There are many counties on the watch list. We have been quite high when compared to other counties. And hopefully we will soon be coming down and hopefully get off the watch list. So we meet with someone from the California Department of Public Health each week and discuss what we're seeing in the county, what actions we've taken, how they can help us. Some of the support that they have given us for the past few weeks have been, we've had 20 contact tracers from the state reaching out to help us deal with all these cases and the contacts. We've also had data entry support, because there is a lot of data entry that comes along with this, and it is very time consuming, the data entry. So that has basically been some of the things we have seen.
Thank you, Dr. V. There's a question from Facebook related to a lot of the terminology that we use. So I'm going to ask this one first, but then I have a follow-up question on a different term. So this question is, what does the recovered status truly indicate? Does that mean the person is out of the hospital? Does it mean that they have completely recovered with absolutely no after effects? Or does that mean that they've been retested and tested negative?
So recovered, there isn't a standard definition. So a lot of us kind of got together from different counties and created a definition, because we needed something to show that not everyone was actively as ill at the same time. So no, people are not completely recovered and 100% back to normal. So what we've really used this as is about 14 days after symptom onset, say, and a person hasn't been hospitalized, they're recovered. They're not going to spread the disease. They're past the time when they would go into the hospital. They're certainly on their way to being recovered better. It doesn't mean that you can't still feel run down, have some lingering cough, but in general, you have recovered. If you're hospitalized, that takes longer to recover, so we usually do that on hospital discharge. So there are a couple different definitions, but that's how we're using it, just to try to reflect active cases and really older cases that are no longer actively ill.
Thank you, Dr. V. The next question is on the phrase underlying health conditions. We know that people are most susceptible to this if they have, or to severe illness if they have underlying health conditions. And tragically, we've lost 145 people in Stanislaus County, many of whom had underlying health conditions. So can you define what that means?
Yeah, so there is a list of underlying health conditions on the Centers for Disease Control and Prevention website, and that is the list we use. So risk factors for severe disease, the number one risk factor is really age. So as your age increases, your risk for severe disease increases. And I think we've seen that. We talk about it with children, how they're at less risk for severe disease. And that increases, and we know that when we see outbreaks in skilled nursing facilities, which tend to have older people, that we will see a lot more severe disease. So age is a large risk factor. And then the other underlying risk factors are quite a bit the same as, like, say, influenza. So underlying heart disease, underlying lung disease, diabetes is a big one. So it's the kind of the usual ones we're talking about in flu season.
Thank you, Dr. V. Let's go over to Scott. Scott, this question came in from Facebook. When opening of schools is deemed safe, will I, as a parent, have an option to continue with distance learning?
Yes, you will. Originally, we surveyed parents who were wanting a distance learning option because for whatever reason they weren't comfortable sending their students to school. That will not change. Even though your school may be approved for a waiver, schools may be reopening. If you are not comfortable sending your child to school, then that will be the choice that you make, and that will be a valid one. So no, if you're not comfortable sending your students back to school and you're happy with an independent study learning situation or distance learning, then you'll be able to do that.
And one more follow-up question. What distance learning support will be available for teachers? And then also the same question for parents.
Right now, as we are gearing up and districts are bringing teachers back for professional development, again, they're doing a much better job as far as what are all of the different tools they have available to do a better job with the actual distance learning. I mentioned earlier that there are some advanced features to Google Classroom, to Zoom, to WebEx, and we're really trying to explore those so that we can make that learning more interesting and creative and collaborative and get more student participation, even though we're doing this virtually. So that is there. And then again, part of the accountability piece is that our schools are doing a better job reaching out to parents, posting assignments so that parents can better track what their students are participating in, what assignments are out there, how can they better help their student complete their distance learning projects, assignments, quizzes, whatever the case may be.
Another question pertaining to schools reopening, but this one's for Dr. V. Dr. V, recently we learned that waivers are required for schools to open in certain counties. We know that the state public health department referenced a framework for reopening in-person learning. Do you know if any waivers will be approved in Stanislaus County, even though we are on the state monitoring list? And secondarily, what would it take for our schools to reopen?
So the criteria set by the California Department of Public Health is double what it takes to get on the monitoring list for a case rate. So that's 200 per 100,000 of 14 days. We are well above that right now, so we do not meet the criteria for waivers in this county at this time. And so we would need to get our case rate down below that number of 200 to even start considering waivers.
So Dr. V, what actions do we need to take to slow the spread and get off the watch list? Can you just really be clear with us about what needs to happen now as we get ready to close the program?
Yeah, so we talk about the 3 W's, and this isn't the www that comes on your web address. These are the 3 W's to slow our spread down, and I talk about them all the time, and they're things that everyone can do, and they don't cost money. So first of all, you wear a face covering, and we've talked a lot about face coverings, a bandana, a scarf. You don't have to spend money on your face covering, but anything like that, it keeps your droplets from spreading to other people, and your droplets have the virus in, so they protect others around you from your droplets, and there may be some data that they're protecting you as well. So that's great. Then watch your distance, so always keep a physical distance of 6 feet from people at all times. Most of the droplets that come out when people talk and breathe will fall to the ground within that 6-foot distance. It's not 100%, but that's a good distance to stay away from people. 9 feet is better, 12 feet is better, but we try to set a minimum of 6 feet. So wear a mask, watch your distance, and finally wash your hands frequently and often. And that is the 3 ways that we can really slow down spread, because it's spreading through droplets, and this keeps you from basically inhaling or getting in your eyes droplets that have the virus in them. I could probably add a 4th W. We heard Ruben talk about getting out and taking a walk. Physical activity such as walking really does help. It helps your mental health, it helps your physical health, and can really be very beneficial for just your whole body feeling better and being able to fight off diseases.
Thank you, Dr. V. Let's head over to Ruben. Ruben, you talked quite a bit about the resources that are available for people that may be seeking help through these difficult times. What can the community do to support each other?
Yeah, yes, although we do have services, I will say and be the first to admit that professional services alone will never be enough, whether it's healthcare or mental health or physical health or mental health. Doctors and clinicians and nurses that definitely can provide mental health interventions, but recovery and taking care of ourselves is also connecting to others within our community and being part of community and staying connected with community. And so those are very important things for those that are seeking help. For those that are not seeking help, and as I said, a lot of us, although we may feel some effects of this through a depressed mood or anxiety, we're going to get through it fine. The majority of us will. And for those that are struggling, one of the things that we encourage folks is and remind folks about is the importance of peer support and mutual aid, and that not only for our own mental health, but for just the overall care in our community, the ways in which we receive help or access to help, whether it's mental health or healthcare, a lot of those systems are strained. A lot of those, especially with our schools, they're not there no more in terms of the way that a lot of our children got help. So, first of all, if you need help, ask for it. And it doesn't always need to be a professional. It could be someone within your faith or spiritual community. It could be a family. It could be a friend. Those are all very powerful supports in our lives, and sometimes we take them for granted and because they're there most of the time, but you start to feel that you need help. It's so important just to reach out to your loved ones or your faith advisor, your spiritual advisor. And then I think sometimes we don't think about this, which is offering help. And folks that are in distress or experiencing some type of mental health challenge, sometimes it's hard to ask for help, and sometimes what we like to do is encourage people to offer help. The last time I was here, I encourage people, if you're doing great, you're doing fine, get on the phone and call 5 people and offer help. And maybe it's a loved one that has struggled with maybe some issues in the past, or maybe they might be struggling financially. It's very important that we understand that although we do have a lot of resources to support, professionally, through government, it won't be enough to get through, and we're going to need each other. We're going to need to be able to help each other, and being proactive about that help and offering that help is very important. And I want to say one last thing about for the folks in our community that do have severe mental illness, and these the county mental health system, we do serve those folks that have more of a severe mental illness, whether it's children or family members. And if you're a family member and you know that you have a loved one that is receiving treatment services and maybe is struggling right now, or they've lost connection with the treatment system, that number is a number you can call to get reconnected as well, is the 558-4600 number. So it also serves in that role as well. So I think overall what we want to realize too is that I saw the numbers just a few minutes ago. We now have 145 families in our community that have lost a loved one, a father, a mother, a sister, a brother, whatever the situation may be. And this is, even losing a family member in normal times is hard. Losing a family member with all the restrictions around being there with them at the end is very challenging. And to lose those numbers of people through this type of crisis just within a short amount of time, we could imagine there's a lot of people out there that are struggling with this. So, lastly, I'll say it's so important that this is a good time to be a little bit more proactive in offering help and connecting with people. And in a normal time, sometimes we don't think of it as such a valuable support. I would say if there's one of the biggest needs we have right now is people reaching out to other people and helping each other and offering that help. And I think if we do that, our systems, the professional systems, whether it's education or public health or mental health, I think we'll have a really good chance of pulling this through with minimal impacts in our community, whether it's mental health or physical health. So just want to share that with our community today. Thank you.
Thank you so much, Ruben. Well, it's past 6:30 now, so that's all we have time for tonight. We want to thank all of our panelists for being here tonight and providing the community with an important update on the COVID-19 pandemic, as well as guidance to help keep our families safe.
And thank you at home for sending in your questions and joining us tonight. If we did not get to your question tonight, we'll continue to try and answer them in social media updates throughout the week.
As a reminder, you can find us on Facebook, YouTube, Twitter, and Instagram. Just search for the keywords Stan Emergency.
Thanks again. Stay safe, healthy, and informed, everyone. Good night.